parts, like, you know, the outside is the cortex. These are the little pyramids. The point is the papilla. And then where it first dumps the waste is the minor calyx, major calyx, pelvis, then the ureter, which runs to the bladder. But most of the IDs are going to be on here. And for male and female reproductive model, so that was with the urinary system, it just dumped blood into the bladder. So here's the bladder, and then that's the urethra, where the urine would come out. This is the ovary. This is the cervix. The cervix is what opens up during childbirth. Okay, right here is not ovary, uterus, cervix. Uterus, cervix. This is the ovary, this little white part, and this is the fallopian tube. Okay, so the eggs are stored in the ovary. We're born with all the eggs we're going to have, and then the egg will be released into the fallopian tube and go into the uterus. If it is fertilized, of course, the baby is going to develop, and then for delivery, the cervix dilates, and then the baby passes through the vagina or birth canal. If it's not fertilized and it's sloughed off, it takes the same pathway, passes the cervix and then through the vagina during menstruation. So you have ovary, fallopian tube, uterus, cervix, vagina, bladder, urethra. That should be all on that one. And then so this is the bladder on the male. So at the back, that's of course the rectum and the anus, but that's not on your list here. This is the bladder, this is the urethra, and then of course this is the penis. Surrounding, okay, right here on the outside, that's the scrotum. Inside is the testicle. This is the bulbourethral gland, or the Cowper's gland. And then this area right here is the prostate gland, the peach area. This, I think, is the, it represents the seminal vesicle, okay? But within, like right by the prostate gland, is going to be, if you look in the book, it's more complete. Not everything is on here, but you'll see the seminal vesicle, and it's close to the ejaculatory duct. So what happens, the sperm is going to come from, it starts off as spermatids within the seminiferous tubules, that's all within the testes. Then it's going to go into the epididymis, which is also in the testes. None of that is on the model here. But within the epididymis, the spermatids will mature into sperm, and then they'll leave the epididymis through the vas deferens, which is also not on this model. The vas deferens is then going to take the sperm up, and then when it gets up here, the seminal vesicle will inject seminal fluid. That is semen, the sperm plus the seminal fluid. And then the ejaculatory duct will put in a sugary fluid that is going to make it motile, so make the sperm can swim. And then it's in the urethra at that point, and then when it passes the Cowper's gland, that's going to inject some alkaline fluid, so that'll raise the pH of the semen, so that when it flows out the urethra, if it goes into the vagina, that's an acidic environment, so then it'll protect the sperm. But like I said, so the epididymis isn't on here, and that may be on your list. The vas deferens isn't on the model. I'm thinking this represents the seminal vesicle. It could represent the ejaculatory duct. It's kind of hard because not everything is on here. But you'll only have to identify what's on here. I'll have to double check for this one to see what it represents. But I know this for sure around it is the prostate gland. This is the Cowper's gland. But you'll have to know like the flow of sperm. So how I was saying, spermatids in the seminiferous tubules, spermatids mature into sperm in the epididymis, goes through the vas deferens. You have to know that whole little route there.